In this module, we talk about swallowing after stroke. In this module, we will be talking about dysphagia, what it is, how it affects you, what are the signs of difficulty, and what can you do about it. Dysphagia means difficulty swallowing. It may be temporary or permanent. It can occur when a stroke affects the area of our brain that controls the muscles of the mouth, tongue, and throat. Dysphagia can lead to serious health problems, such as coughing or choking, not eating, dribbling or drooling, or problems with chewing. Problems can occur in one or several phases of swallowing. It can be problems with chewing, moving food to the back of your throat, moving food through your throat, and moving food into your stomach. Aspiration occurs when food, liquid, or saliva passes below your vocal cords and into your airway. Bacteria that's carried in the food, liquid, or saliva can cause aspiration pneumonia. Normally, your lungs are protected by a cough when food goes the wrong way, but a stroke can affect your body's ability to protect its airway. Over the next few slides, we will identify some signs of a swallowing problem. This could include difficulty taking food from a spoon, excessive saliva or drooling, pocketing food between the gums and cheeks, the feeling of food sticking in your throat. Throat clearing, coughing or choking, changes in your voice, wet, gurgly, or hoarse sounding when eating or drinking, gulping when you are swallowing, problems breathing or shortness of breath during meals, chest congestion or infection. Let's talk about what we can do if someone cannot swallow or is having trouble swallowing. The speech-language pathologist can change the consistency of fluids. Thicker fluids move more slowly. They're less likely to go the wrong way. And these can be mildly thick, like nectar, or moderately thick, like honey. The speech-language pathologist can alter the food texture to make it easier for a person with swallowing difficulties, which can include difficulty chewing, moving food off of the palate or out of the cheeks, and moving food to the back of the throat or down the throat. Some of these texture changes may include puree. These are foods that do not need chewing. They are completely smooth with no lumps, skins, strings, or seeds. Minced solids, which are foods that are easier to chew, or soft and bite-sized pieces. Speech pathologists can also use strategies to reduce the risk of aspiration and do swallow therapy. Some of these strategies include good posture when eating, frequent oral care, safe feeding techniques, and swallowing exercises. Speech-language pathologists and your doctor may suggest that the safest way for you to get nutrition is through a tube. This may be temporary or for a longer period of time. There are habits that you can practice if you have a swallowing problem. These will often be given to you by your speech-language pathologist. Some of these include sitting up straight, taking small bites, chewing well, swallowing hard, or swallowing twice after each bite. Do not talk when eating. Clean your mouth before and after you eat, and check for food in your mouth after you have eaten. Sit up for 15 to 30 minutes after you have finished eating. Follow any recommendations made by your speech-language pathologist, and make sure you ask questions. As a family member or caregiver, make sure you also ask questions about special diets, textures, and recommendations that are made by your speech-language pathologist. Check with nursing staff or the speech-language pathologist before bringing in food from home. Family and caregivers can also encourage you to feed yourself. Ensure you are sitting upright, that you're taking just small bites. They can sit at eye level in front of you or beside the bed, and they can also remind you and help you to clean your teeth. As you listen to this module, how has your swallowing changed since your stroke? Is it better, worse, or no change? It's important to remember that the speech-language pathologist will work with you to develop an individualized plan. So if you have questions or want more information, remember to talk to your speech-language pathologist.